Hello everyone and welcome to my channel. I'm Dr. Renee and I am an infectious disease doctor. I will be posting weekly videos on sickle cell disease and I will also be discussing some infectious disease topics. So today I will be sharing CDC guidelines for monkeypox in the school setting as well as early learning settings and other educational settings as well for children and adolescents. So based on the epidemiologic information we have so far, and according to the CDC, the risk of monkeypox to children and adolescents in the United States is low. But of course, due to the fact that we have seen increasing rates of monkeypox in some cities, namely New York and California, and children are also back to school and some are on their way back to school, that the updated guidelines was necessary to help people navigate the system and the process of what they should be thinking about when they're thinking about their children going into these different settings where they could potentially be exposed to monkeypox as well as other infections. So the first thing that I want to just delve into is talking a little bit about one of the most commonly asked questions. And one of the primary questions that I get asked about also is should teachers, staff, students, and volunteers get vaccinated for monkeypox? And at this time, according to the CDC, there's no need for widespread vaccination for monkeypox among children or staff at the kindergarten to 12th grade level or in early childhood settings. The CDC does currently recommend vaccination for people who have been exposed to monkeypox and people who may be more likely to get monkeypox. And this includes three groups. The first group is people who have been identified by public health officials as a contact of someone with monkeypox. The second is people who know one of their sexual partners in the past 2 weeks who has been diagnosed with monkeypox. And the third is people who had multiple sexual partners in the past 2 weeks in an area with known monkeypox. So that is the current recommendations for vaccination according to the CDC guidelines. The next question is, should a teacher, parent, or student with a rash get tested for monkeypox? So the first thing to keep in mind is that there are other viral illnesses that can cause a rash and fever in children, such as hand, foot, and mouth disease, which both of my children have had, as well as other viruses such as the varicella virus, which causes chickenpox. For a child without a known exposure to monkeypox, a fever and rash should be evaluated by a healthcare professional, and the setting that particular child is in should follow their standard illness policies for their facility. Again, it's really important to reiterate this and to keep this in mind, that there are multiple potential causes of rashes in adults. And so parents, teachers, staff members, volunteers, all staff should have an understanding of what the symptoms of monkeypox are, and to see a healthcare provider if they are concerned about exposure to monkeypox. Adults with symptoms of monkeypox should also make sure to avoid close contact, including being intimate with anyone, until they have been checked by their healthcare provider. And if they either don't have a healthcare provider that's available and health insurance is an issue, then the next step would be to go to your nearest public health clinic. It's also important to keep in mind that you should always wear a well-fitting mask when you are seeing a healthcare provider. Another common question is, should I get tested if I have been exposed to someone with monkeypox? So there are there's not currently a test for monkeypox unless one has developed a rash after known exposure to monkeypox or is suspected to have a rash secondary to monkeypox. If a rash does develop, an individual, of course, should follow isolation and preventive practices until they can be appropriately evaluated by a healthcare provider to have testing performed. They should also make sure to, adhere to the recommendations that their healthcare provider might recommend, and also make sure that they're confirming the results of that test for monkeypox. Another commonly asked question is, what if someone in my setting has monkeypox? And that could be any setting, right? The focus of this video is, of course, on all childcare settings as well as schools. So if someone with monkeypox has been in a school or an early learning setting or a setting serving children or adolescents, this setting should follow their daily protocol or operational guidance to reduce the transmission of infectious diseases of any kind. And this includes enhanced cleaning and disinfection. So, for example, in a case where it's a childcare setting, the classroom or space that where the person with a monkeypox spent time should be cleaned and disinfected before further use. They should focus on disinfecting items and surfaces that were in direct contact with the skin of the person with monkeypox, or often in the presence of the person with monkeypox. It's also important to keep in mind that linens or towels that the person with monkeypox may have used should be laundered. If for any reason those items cannot be cleaned or disinfected or laundered, they should be thrown away. Children who are, or any staff members, volunteers, anyone at all that could potentially be exposed should not be allowed to enter into that area until appropriate cleaning and disinfection has been completed. Another commonly asked question is, when can someone with monkeypox return to a child care setting or a learning or school setting? As I mentioned in my previous video, monkeypox causes a rash with lesions that eventually scab over. People with monkeypox should isolate until all the scabs have fallen off and a fresh layer of healthy skin has formed. This can take as long as 4 weeks after symptoms begin. Also, staff or volunteers who have monkeypox should isolate and be restricted from the workplace according to CDC's isolation and prevention practices. The CDC also advises employers to provide flexible, non-punitive sick leave policies for their staff members. And I think that was an important part of this guideline, to actually clearly state that and to have clear instructions for what the expectations are for employers. So should we allow someone in our setting who has been exposed to monkeypox? Well, according to the CDC, children, staff, and volunteers who are exposed to a person with monkeypox do not need to be excluded from an educational setting in most cases. In some cases, of course, there are exceptions, right? So in some cases, if contact tracing may not be possible and there was a high degree of exposure to monkeypox, the health department may consider limiting a person's participation in activities. The health department, obviously would consider the age of the individual, their ability to recognize or communicate symptoms, and the type of interactions in that particular environment, as well as the risk of more severe disease to others in that particular setting. The CDC is also has recommendations and considerations for congregate settings such as college and university settings. And for more information on that, I have the link below, the resource link that you can find below for more information. Another commonly asked question is, what should parents do if their child was exposed to monkeypox? So, children and adolescents who are exposed to monkeypox should be monitored for symptoms for 21 days, which is equivalent to 3 weeks. When monitoring a child for illness following exposure to monkeypox, caregivers should check the child's temperature daily. They should also perform daily full-body skin checks for a new rash and inspect the inside of the mouth for any sores or ulcers on young children. In older children and adolescents, parents can, obviously supervise and help them with inspection of their mouth and exposed skin areas that may be difficult for the child to see, such as the back of the neck, the arms, as well as the back of the legs. They should also remind their children to be aware of any rash or pain in areas covered by clothing, including the genitals. And those areas should also be inspected frequently, and with the instruction that if there are any skin changes or any pain, anything that is new to your child, that will be further investigation and evaluation for possible monkeypox. If a child or an adolescent develops symptoms while at home, the caregiver should contact the local health department as well as their healthcare provider. The child should not return to the educational setting until they're medically assessed. So the next question is, what should a parent with monkeypox do if they cannot isolate from their children? And I'm sure that this is something that a lot of parents have been asking about. Well, what do we do if there's only one parent in the home, or we do have two parents in the home, but the other parent is unable to care for our child or our children? Well, in that case, the only option is that you as the parent would continue to care for your child while taking prevention precautions. And so while continuing to care for your child, during those interactions, you as the parent or the caregiver should cover your rash with clothing or gloves. You should also wear a well-fitting mask and follow other prevention practices as outlined by the CDC. If the child is 2 years of age or older, they should also wear a well-fitting mask during interactions with a caregiver who is infected with monkeypox. The CDC does have guidance for how to clean and disinfect surfaces, floors, and shared items used by the person with monkeypox, and those guidelines should be followed. You can find the resource link again below for more information on that as well. The CDC also advises that the infected parent should work with their doctor and the health department for further guidance on the child's activities outside the home. Of course, this will depend on the individual and their particular circumstances, what the restrictions of activities would be. It is also important to discuss vaccination for exposed children with the health department. A vaccine is available, and it can help prevent monkeypox in people who have been exposed if it is given soon after exposure. And so the best thing to do if you do have someone that has been exposed to monkeypox is to also keep in mind to contact your healthcare provider as well as the health department. So that completes my overview of the most commonly asked questions and about monkeypox and the CDC's response to those questions. The CDC does have other valuable information on monkeypox in their updated guidelines. And the updated guidelines that I discussed today is from August 19th, 2022. So please check out the resource link below. Also keep in mind that if there's anyone that you know that's had exposure to monkeypox in your setting that is confirmed to be positive, it is very important that you contact the health department, because contact tracing is very important in preventing further spread of the virus. So again, that completes my talk today about the questions that many people have about monkeypox regarding their children and what to do should they be exposed. And so I hope that this video was helpful, and that's all I have for today. If you like this video, please press the thumbs up button, subscribe, and leave comments below. God bless, and I will see you next time.